Back for another conversation with 9 News Director of Reporting Chris Vanderveen, who's our point man on our COVID-19 coverage. We've been having these extended discussions, which some of you have told us are useful. We post them on the next YouTube page so that we can really dive deeper into some of the issues and what we're seeing week by week with the COVID picture. Chris, first off, it seems like we're seeing a bit of a plateau in terms of new cases and hospitalizations at a high level, but a plateau.
Yeah, we keep waiting for that Thanksgiving bump, and so far that Thanksgiving bump really hasn't materialized. That's good news, and there's lots of speculation in the state as to why that may be the case. But regardless of what their thoughts are, we're not seeing it yet. Doesn't mean it's not going to happen, but really that window to see it is really from Monday of this week to probably Monday of next week. If we don't see it by then there's some indication that maybe we're not going to see it at all.
And Chris, what might some explanations be apart from COVID is a hoax, it's voodoo, none of it matters?
Oh, isn't that what we're trying to explain to folks? It is a hoax. No, it is not a hoax. The issue here is, I think that it's multifaceted. That's a question that was asked of CDPHE earlier today, this idea of what is causing this lack of a bump. I think there's some consensus that you reach a sort of a level within a community where everybody starts to know somebody else that got COVID. And irregardless of their thoughts on the restrictions, they start to naturally restrict themselves more. So essentially, the more virus you get in the community, the more people that get sick, the more chances of you knowing somebody who gets sick, and the more chances of that leading you to stay indoors more and limit your activity. I think there's some thought that that is leading to it, but I also have sort of a thought myself. I think it's complicated. I don't think there's really one simple explanation as to what's going on, but clearly something's going on.
Chris, it strikes me that there might be some kind of parallel that we could draw between the way the virus moves through the community and the way that we watch, like, forest fires work, in the sense that it's the most easily accessed, most combustible stuff that goes first. And we saw in that spring peak some of the most vulnerable in our community in the nursing homes. That's where we saw the deaths. We've seen another peak, which again, toward the older population, but more widespread. I mean, at some point, not talking herd immunity, because we're so far from that, but does the virus kind of like burn through the available number of people who find themselves in proximity to it?
Kyle, I think that's a really good analogy. I've used the analogy of trying to get a campfire started, that sometimes it takes a little while. You put some effort into it, it gets going, and it flames out. And what we've seen now twice, in particular back in April and now back in November, you've seen it really burn very hot and very, very quickly. That's what's happened. The question is it burning itself through that vulnerable population that you start to look, you get people who are vulnerable to the virus, and then after that it sort of runs out of wood, it runs out of places to go. That's a possibility of what's happening here. But as you said, we're nowhere near that 70% that's generally thought that we need to get to herd immunity. So we've got a long way to go, but clearly something is slowing the virus.
One thing that I think we've become numb to, it's just kind of terrible, is the sheer number of Coloradans who continue to die of COVID-19 in excess of the numbers that we saw in the spring peak, when I think everybody was fixated on it and saying, how could we be losing this many people?
Kyle, there were so many people that about 3 or 4 weeks ago were continuous, and they're pointing out, what about deaths, Chris? What about deaths? What about deaths? And I kept saying, and this will sound horrible, but I kept saying, wait. You're going to have to wait to see those deaths come through the system, because as we talked a long time, deaths lag. And what you have now in Colorado is unprecedented in this pandemic. We're now seeing in excess of 40 people a day that are dying from the virus, when about 2 months ago that number was 3 or 4. So some of those worst case scenarios that the state was talking about just a few weeks ago, we're nearing that point where we could see that. And that is a problem within this state. There were so many people that were downplaying deaths, saying we weren't going to see as many deaths as we saw back in April. We've now eclipsed that. And Kyle, as you know, the problem is that number continues to go up. Yesterday, the 7-day average went from 38 to 44 in one day, with the addition of a number of with a lot of new data. The question is, how high does that peak get? If we get to 50, if we get to 60, some of those models, that worst case scenario models, really start to come nearer in terms of reality.
So, Chris, we learned earlier this week the state's updated vaccine distribution plan, going to medical workers in contact with COVID patients first and so on down the line. One thing that jumped out to me and a number of Next viewers is that teachers are in phase 2, roughly described as springtime. Schools want to get back in session in the second semester. The governor's pushing them to get back in session. So what that means is that teachers, the older folks in schools, are going to be sent back in pre-vaccination.
This is going to be a huge challenge for schools come January and February. And Kyle, you know this. A lot of school districts around the state are already readying their plans to get kids back in school by January and February. The problem is the same problems that existed back in November when they started to close schools still exist today. We can't test quickly. We don't know what the virus is doing. And with a lack of vaccination with teachers and with students, you're going to have some of the exact same problems that you experienced in November, just now back in January and February. How they deal with that will be a huge challenge. And quite frankly, Kyle, I don't know if they're up to that challenge right now, because what are they doing differently now? Or what are they going to do differently in January that they weren't doing in November? I don't see a lot of change in activity. There's some districts that are doing more testing, but this will be a huge story come January and February.
Some of Colorado's largest COVID-19 outbreaks have been in prisons. Same story around the country. That's the reason why the American Medical Association says you need to vaccinate everybody inside prisons early. The correctional officers, the staff, all the inmates, that kind of thing. That was Colorado's original plan, to follow the medical recommendations. And now, under pressure, Governor Polis and his team have decided that instead they're going to disperse inmates kind of throughout the vaccination schedule. So older inmates, medically vulnerable inmates will get it earlier, and younger inmates will not. If you'd permit me a moment of analysis, it seems to me like the elected leaders, like Governor Polis, who have said we will follow the science. That's a pretty solid place to be through this, in that the science is leading us. Where it gets tricky is when they say, we'll follow the science until the political heat gets too hot, like on the idea of vaccinating an inmate before your grandma, and then we'll divert from the science.
I mean, the reality is, Kyle, is that it doesn't make a great campaign slogan for anybody to go out and sort of say, hey, we're going to vaccinate a prisoner before we vaccinate your grandmother. The reality is, and the science is that the science is telling you that's precisely what you need to do. The problem is, as you've hit on quite eloquently, is that those two ideas are now clashing with each other. And this will not be the only ethical decision moving forward. You see very broad levels of people within those levels of vaccination, whether it be prisoners or other people. Some people are just going to simply move to the front of the line in front of other people, and there's going to be a lot of questioning as to whether that was the smart thing to do. It is going to be a challenge for the governor. It's going to be a challenge for the State Department of Public Health to sort of move forward in a way that makes sense, that goes along with the idea of the science, but they've already hit a stumbling block when it comes to prisons right now.
A final thought, Chris, on the issue of vaccines. When the state's plan came out earlier this week, it became apparent that some of the governor's more hopeful predictions about maybe everybody having access to the vaccine in late spring is not what the state currently thinks is going to happen, and that the majority of the population, phase 3, those who are not at elevated risk, aren't going to see the vaccine until the summertime. I felt pretty deflated looking at that, going, shoot, I had April, May in my mind, being hopeful. All this is dependent on when we can get our hands on the vaccine.
Yeah, Kyle, I heard that as well. And the summer seems awfully late when you keep waiting for that light at the end of the tunnel. But here's really the issue as I see it right now, is that you're going to be vaccinating really the most vulnerable within the population within the next month or so. You're talking about healthcare workers, people in long-term healthcare facilities. Then what? When the rest of the population isn't vaccinated, but the most vulnerable people in the population are, and you start to see the cases go down, there is going to be a huge amount of pressure put on government officials to start to ease back on restrictions before the rest of us have been vaccinated. Look for that to be a very big story come late January, around February, because in reality, we've been told this whole entire time, we've got to keep the number in hospitals low. We've got to make sure we don't outperform the system, that it's, in essence, too many patients show up at the hospital, we can't care for all of them. If you start to lessen that threat, and younger populations still aren't vaccinated, there's going to be pressure to open up, turn that spigot, as I like to call it, even more. The question is, will the government do it at the request of businesses? And then, if they do, what's the net result of that when a large population still isn't vaccinated?
Sure. And on a very personal level, then the squeeze, again, is put on people who are not at risk, but who are in close contact with those who are at risk. Everybody who's got a mom or a grandfather or somebody who's immunocompromised in their life. You know, at the end of the day, we're talking about people, we're talking about families, and a lot of things at play. Chris, thanks as always for your time.
You bet.